Hi everyone. So I thought today that I would film a quick video about the most common benzo symptoms I see, and this is from the perspective of someone who's been coaching for about a year, and coaching gives a unique perspective because it's very different from reading on a forum. Just having a one-on-one discussion with someone is revealing, and I tend to notice patterns, and so that often will prompt a video. And keep in mind that, of course, this doesn't apply to every person in benzo withdrawal, and it also doesn't mean that if you have this symptom from a different drug that that's not possible, or that it's not possible to get these symptoms from other classes of drugs, because it certainly is. But I've noticed that it's the most common in the benzo community, or that these are the most common in the benzo community. Also, I have noticed there are differences among the different types of benzos, what symptoms are present. So I'll maybe get into a little bit of that, but in general, I'm talking about all the benzos. So the first one is burning skin, and I see this in probably 80% of benzo users. They will get burning skin. Some people describe it as an acidic feeling, or burning acid blood, or they'll say burning muscles, burning nerves, burning bones, burning skin. And I would say the most common places that I see it are in the head and face area, and also like in the torso. But it can also be your entire body. It can be everything at once. It can be different sections at different times, but this is a super common benzo withdrawal symptom. And I understand that there's symptom lists on websites and in other places, but I'm just speaking from my experience in talking to people, plus my own experience. The second one would be pressure, head pressure specifically. I talk to so many people in benzo tolerance, benzo withdrawal, who have a feeling of head pressure, and that pressurized feeling tends to be the most common in the head, but I've also seen people describe it in other areas of their body, but the head is by far the most common. I didn't experience it myself, but so many people, again, a very high percentage of people that I talk to in benzo tolerance or withdrawal have this symptom. The next one would be muscle problems. So there's a wide range that this can fall under. So it could be often extreme muscle tension, or some people will describe it as rigidity, or like a clamping up, squeezing feeling. Or it could be feeling like your muscles are made of cement. It could be muscle twitching, like fasciculations, muscle jerking, muscle, like so many different muscle symptoms, and or like like your muscles are constantly contracted or cramped up. That's another common symptom. Muscle weakness is, I would say, not as common, but definitely falls under the umbrella for sure of benzo withdrawal symptoms. Just tons and tons of muscle stuff. So myself, I had a lot, like pretty severe muscle jerking. I also had random twitches, like I'd get them in my face specifically. And that is very common amongst people that I talk to as well, all of these different muscle symptoms. And this kind of falls into the next one, which is neurological, but specifically, other than the burning, which I believe is a neurological symptom, is inner vibrations. So for myself, I had some pain, muscle pain, that's also included in this, from SSRI withdrawal, but it wasn't until I took benzos and came off them that I really experienced crazy amounts of muscle symptoms, and also the inner vibrations. I didn't have inner vibrations from 7 years of SSRI use, but after only 3 months of benzos, I had major muscle jerking. I had everything that I just listed. Essentially, I had the burning, I had the vibrations, I had the jerking, I had the twitching, like fasciculations, and then also the nerve, like, and that always included pain, and then the nerve stuff. So inner vibrations, burning, all of that. So very, very common in benzo withdrawal. The next one would be tinnitus. So again, I didn't have tinnitus from 7 years of SSRI use, which included only a 4-week taper. But I guess my tinnitus did come when I was reinstating and playing with other drugs, specifically when I started Prozac. I got tinnitus, but then it didn't get to more severe levels until I took benzos and came off them. So tinnitus, I almost always ask people if they have tinnitus because it's such a common symptom. And I would say that those are the big ones. Obviously, like, also included in that is severe anxiety, and that can include insomnia as well, although not always. Now, when you break up the benzos into specific drugs, one thing that I've noticed is if you have taken clonazepam, this one, for some reason, like oftentimes people can just describe what they're experiencing mentally, and I'll say, did you take Klonopin? Because I noticed that with Klonopin, people tend to have more mental symptoms or more severe mental symptoms than the other benzos. But this doesn't mean you can't get them from the other benzos. This doesn't mean you can't get them from other psychiatric drugs. But with Klonopin specifically, the mental can be quite severe. I had severe mental symptoms and I did not take Klonopin. I took lorazepam slash Ativan, and I already had it pretty bad from the SSRI withdrawal, specifically citalopram, but it went to insane levels after benzos, which included like tactile hallucinations as well. And so those are, yeah, Klonopin specifically. Valium tends to be more like sleep issues, and the other two, like kind of main ones, so Ativan and Xanax, it can be any or all of the above. And I haven't noticed as specifically like differentiating symptoms with those benzos as with Klonopin with the mental and Valium with the insomnia. And there's of course other symptoms you can get, many other symptoms from benzo withdrawal, but these are the most common. Sometimes people will experience like memory and cognitive issues as well, but I don't see that as commonly as the other ones that I've just described. And you know, a lot of times too, the symptoms will cluster. So if you have the head pressure and you have like kind of the stuff going around your face and head, people will often have DPDR that goes along with that, and tinnitus. Sorry. Loud motorcycle going by, but I would say that those are the main ones. I'm sure there's other ones that I'm missing that people experience as well. I know there are, but those are the most common ones that I see kind of straight across the board, and that plugged into an electric socket feeling, which would go with the neurological symptoms. I didn't experience neurological symptoms until I took benzos, even though I had taken SSRIs long term. So let me know if that falls in line with your experience. And again, this is just a generalization. These are just things that I see, and you can pretty much get any symptom in the long benzo lists with any benzo, and you can also get these symptoms from other drugs as well. But that's what I've really noticed in talking to people. So one thing that I forgot to mention before, and I'll just splice it into this video, is people who have taken benzos tend to have more sensitivities, more hyperreactivity to supplements and more medications. And again, that's not always the case, but it's generally a pattern that I've noticed. Akathisia is mixed. I tend to see it the most with either benzo withdrawal or reinstatements. That's the most, interestingly enough, you know, doctors will always say, oh no, akathisia is from antipsychotics. I actually quite rarely see it from antipsychotics. I more often see it from benzos and from reinstatements, whether that's from or back onto antidepressants or whatever it might be. So yeah, I just wanted to add that in. Yeah, let me know if that falls in line with your experience, and I hope you guys are doing well, and I'll see you next time. Bye.